Welcome back to a special mini podcast series on cancer care during the COVID-19 pandemic. Today, the race to find PPE and the creative measures taken by some oncology programs to get what they need. Here's Lori Trito, the Clinical Operations Director at the Todd Cancer Institute in Long Beach, California. I understand that you have a bit of an interesting story with PPE during the pandemic, and there might even be a classified ad involved. Can you tell us a little bit about that?
Yes, at the beginning of COVID, our marketing team put out an ad in our local paper saying that would be open for community donations. So that did include donations of masks or gowns or other forms of PPE, as well as other generous offerings from the community.
Who decided to do that, and then what was the result?
Well, I believe it was our marketing team in Long Beach, California. We have a really active community. We are a community hospital. And so we have lots of people who wanted to participate and do what they can. And I received calls here at our cancer center for people who wanted to make sure that cancer patients had PPE also. So we have gotten calls from all over the country. I had a call from Canada, and they wanted to make sure that they could donate 1,000 surgical masks. And so what does that mean? Having to order masks from Canada, for example, that's crossing a border. And so our marketing team helped to generate a letter from our CEO of our medical center to allow a donation of this kind to come across the border. And so we had that both from Canada as well as Mexico. We had surgical masks, N95 masks of all sizes and quantities. We've been really very lucky and have had so much community support.
What about preparing for a second wave? Do you anticipate any shortfall then, or are you going to be able to rely on the supply that you have now?
So we've had to make adjustments for certain items. So we're maybe not wearing the same gowns that we would have worn traditionally at our hospital. Maybe they're not always the same N95 masks, but I feel like we have not seen a shortage currently. And I know we're always projecting for the future because we have not seen an end to COVID in our area, nor have we really seen a flattening. We're kind of bumping along and maybe bumping up in some ways. So I think definitely a second wave is something that we're all preparing for. And I know that our system is helping to make sure that we're able to go the distance.
You alluded to not using PPE in the same way that you probably would if it wasn't a pandemic. Have you found or created any new ways to safely ration PPE, washing or sterilizing masks, that sort of thing?
Yes, our hospital has created a system to sterilize N95 masks. The N95 masks actually that were sterilized have not come back into use, but were kind of put to the side for the just in case. As a healthcare professional, we're always kind of stockpiling and preparing for the worst, right? And I think that we've done a good job with that, but that has not been something that we've needed to do. So they're actually ceasing the sterilization of N95s at our hospital. And I think we're just really preparing to be creative in the types that we're using. So maybe it's a different manufacturer that we would typically order from, but they're able to help us to make sure we have the PPE that we need.
So what's the difference between PPE use for COVID and then for USP 800 hazardous drug handling?
So we've really been through a lot of development to prepare for USP 800. We've been preparing for this for years and really finally gotten it all down. And then COVID hit, and there is concerns about making sure that we have enough PPE. The types of gowns we wear for hazardous drug handling is different than the isolation gown that's used for COVID. It's impermeable both to moisture and hazardous drugs. It's rated for USP 800. So there is a different type of isolation gown that we wear for COVID, and it's not the same. And so that's one difference. So we have plenty of gowns for the hazardous drug handling. And then the gloves are all the same types of gloves, but we wear 2 pairs when we're handling hazardous drugs. And then we have goggles that staff can wear if there's risk of splash. Goggle usage is changing within, day to day, because we're seeing that when you're caring for someone who has a risk of aerosolization, that you really should be wearing the eye protection more and more. Or if you have a patient that's unable to wear a mask, then they have more risk of spraying, secretions without knowing it, and goggles are more utilized. So we have ones that we can wash and recycle, and so that someone could have a pair of goggles and keep them until they're scratched and they can't really see through them. So we want to make sure that people have the right equipment at the right time and then can replace it when they need to.
The novel coronavirus has generated a lot of strain on cancer care professionals, and ACCC is working to bring you the resources that you need throughout the pandemic. Next week, we'll look at COVID-19's effect on immunotherapy clinical trials and how cancer programs can safely continue to deliver those trials. Until then, for the Cancer Buzz team, I'm Summer Johnson. Stay well.